We're going to hear today from two presentations, two recent and current research projects that have been funded by the NIHR School for Social Care Research and that are specifically focused on the needs and interests and support for carers. So we're going to have the first presentation from our colleagues at the University of Kent, which will roughly go for 20 minutes. And then we'll pause for some questions, and then we'll have the second presentation, which is from Aggie, Liz, and myself in the School for Policy Studies. People are welcome to put questions in the chat box as they come up. We'll come to those questions when we pause after each presentation, and we should have some time after both presentations to have some general question answer discussion. So please feel free to post your questions in the chat box as they come up, and the presenters and myself will keep an eye on that as we go. So without any further ado, I'd like to welcome Stacey and Wenjing. They're going to be presenting on supporting older carers and the people they care for, the dyadic impact of social care. So Dr. Stacey Rand is a Senior Research Fellow at the Personal Social Services Research Unit at the University of Kent. Stacey's research interests focus on carers, social care, and the quality of life outcomes of care. And Dr. Wenjing Zhang is a researcher at the Centre for Health Services Studies at the University of Kent. And Wenjing's research experiences and interests focus on ageing, social care, migration, and international and comparative social policy. And Wenjing has been working on this current study, with Stacey. So Wenjing and Stacey, a very big welcome. We look forward to hearing about your study. Over to you.
Okay, thank you very much, Paul. And thank you for the introduction to this particular study, which I'll be presenting, but Wenjing is also here and will be available to answer any questions and be involved also in the discussion. The research team also includes three other colleagues, Grace Collins, Barbara Shilarova and Alison Milne, and we're all based at the University of Kent. And as Paul mentioned, this study has been funded by the School for Social Care Research. So the usual disclaimer, but also thanks to them for the support for this particular study. So in terms of some background, the seminar today in the title talks about supporting carers during COVID. I have to here add a disclaimer that this particular study was put together and funded before the pandemic. So the context and the focus actually didn't originally have COVID in there. And what I'm presenting today will acknowledge COVID, but actually has a slightly different focus. The focus is very clearly on supporting carers, but with a particular interest in those carers aged 65 and over. This is a group of carers that's growing, apparently quite rapidly, and they represent about 20% of carers in the UK. They have a particular set of needs and a profile that we need to be aware of. They're more likely to be caring for someone who lives with them, typically a spouse or partner, but could be adult children caring for an aging parent or a parent caring for a disabled child. And we know from both practice and also the evidence base that this subgroup of carers are less likely to recognise and identify themselves as carers. And because of that, sometimes find it difficult to seek support or know where to look for that support. And also because of their own ageing and that experience can have particular needs related to that, or also their own health problems. And because of that, this group has their own needs profile. And our interest is the way in which community-based services are working with older carers to support them and to improve their quality of life and well-being. But also not just thinking about individuals, because we know obviously that people who are caring and in a caring relationship have the person they're supporting as well. And for a whole raft of different reasons, there tends to be a view on individuals, both in research and also in the provision of services, But actually, in reality, people are in relationship with one another, and particularly with caregiving. A relationship is at the centre of what's going on. And so the question is, how do we apply a lens, a dyadic lens, where we're thinking both about the carer and the person that they support together? So the aims and objectives of this study are asking these questions around how do services, community-based services, improve the quality of life of older carers, both individually and looking wider also at the person that they support. And we use this word dyad as a shorthand for talking both about the carer and the person that they are supporting. As part of this, we're wanting to understand how social care professionals see their role in supporting older carers and the people that they care for. And also thinking through some of the benefits, but also challenges and barriers of applying what we call a dyadic lens. So thinking beyond individuals, but looking at units of carers and people that they support together. And part of the reason why we're interested in this is really to scope together the evidence, to try and get a broad view and to extract key learning that can be applied in policy making, service planning and delivery, care practice and commissioning. So in terms of where we are with the project, it's a 2-year project which started in September last year. So we're sort of 8 months into the project, and it has 3 main strands. The first of which is a scoping literature review, which will be part of what is presented today with the preliminary findings from that. But there are also 2 data collection strands, qualitative interviews with social care professionals, which has started, and again, some initial findings will be shared in this presentation. And also a 3rd strand, which we've started in the last week or so, which is interviewing with caregiving dyads, so carers aged 65 and over, and the people they support and care for. And in this work, we're trying to very broadly look at people engaged with community-based social care from a variety of contexts. So people who are self-funding as well as people receiving publicly funded support. So the first set of findings to share with you is the literature review, which we're coming towards the end of that. The review itself has been completed and is being written up. And the question that we wanted to ask was very broad. We're really wanting to scope the evidence around what is known about the quality of life of older carers and the people that they support. And in asking this question with the funder, one of the things that came back with the proposal was the thought that perhaps already a lot is known about this. So what we really wanted to do was just to check, because in our initial reviews, it does seem that there's a gap in the literature, and we wanted to make double sure that that's the case. And we followed traditional scoping review methods with 5 stages, from developing the research question through to finding and extracting relevant evidence, and then collating and synthesising it. Thank you. So I apologise that this diagram is slightly small, but I hope you can get a general sense of what is being shown here. So it's showing from the top down to the bottom the process of sifting, identifying and sifting through relevant articles and reports and evidence. And my colleague Wenjing led on this particular piece of work, and over the last few months has done a very impressive job of going through lots and lots of different sources of evidence and sifting that down. In this work, we've been helped by our advisory group, some of whom are on the call today, and we're very thankful for their support, both in helping us to identify the research question and also reviewing some of the findings, making sure that we're drawing in relevant grey literature. And the key thing on this diagram is that we've ended up with 14 relevant articles, reports and papers. And this is just a very brief summary of some of the key characteristics of those papers. Interestingly, 6 of them come from the UK, but we've got coverage from also US, China and some international studies. Most are journal articles, but we also found 1 PhD thesis that was very relevant and 2 reports. And these represent a range of study designs and approaches. So in terms of the key findings, there were three themes that we've identified from the literature, which I'll briefly present now. The first of them is perhaps more theoretical, but I think is quite important. And it's asking, how do we think around dyads, and how do we then analyse and understand dyadic quality of life? And I think this is important because it helps us then organise and think around the topic. So there were three approaches that we found. The first is under the umbrella of what's called interdependence models. And these approaches help with quantitative data, so usually survey data, where you can actually not just look at individual influences on quality of life, but you can also begin to look at two individuals together and look at that dyadic influence as well. And we'll come back a little later to that, but it's actually a really useful approach at unpicking the different factors and influences. Perhaps unsurprisingly, there's a whole raft of approaches that look at and try and understand relationship dynamics. So these are things like social exchange theory and equity theory, which are based on the idea that over time, on average, exchanges between individuals are roughly equal, and that caregiving can be understood in this way. Again, perhaps not a surprise, but also theories that relate to conflict and incongruence of quality of life within dyadic relationships. And also very relevant to caregiving, things to do with stress and adapting to changing circumstances and coping with that, not just as individuals, but also as a caregiving dyad. So these first two are relevant to carers across the life course, but because of the focus on older carers, we also found some studies that looked at theories related to ageing, so things like continuity theory, disengagement theory and activity theory. So this is how people in the ageing process may continue or adapt their activity and engagement with things in their everyday lives. Thank you. So the second theme is really then taking a step back and thinking around dyadic quality of life and what that really means. And the way I try to explain this is it's very easy for us to think about an individual and their well-being and the different influences that there may be on that individual. What we're trying to say is that you, within a caregiving dyad, also have influences that are the two people together, and that there can be a direct impact on quality of life with those two people that often comes through the relationship. So the first set of bullet points here are really talking around some of those relational aspects. So we know that caregiving, both giving and receiving care, has an impact on people's sense of self, their identity, their personhood, and that is related also to their health and well-being. And particularly with caregiving, there's an important lens that needs to be applied, that this doesn't emerge from a void. Caring develops from existing relationships, and those existing dynamics and also the way in which they sit within wider family dynamics are also important to be aware of. In the second half, I talk about mutual interdependence, and I mentioned this in the analytic approaches earlier. And this is a way for us to make sense of data on a larger scale. And it helps us to be able to model not just the individual influences. So, for example, we know that an individual's health status will affect their well-being, but we can begin to look at an individual's status and the impact on the other person. So say the care recipient's level of dependence or health needs, we know, using common sense and also looking at data, that can impact on the carer's quality of life. But also factors around the carer can also have an impact on the person they support. And aside from these, which we call actor effects or partner effects, there's also something we can model, which is about the influences at the level of the dyad. We call that mutual interdependence. And again, we can think around that in terms of the social exchanges, the relationship between a carer and the person they support, and the way in which that can directly affect one another's well-being, and we can actually model and understand that. So the third theme which we looked at, which of course is a key interest for this study, is about the formal and informal support influences on quality of life. And perhaps reassuring for those of you on the call who are coming from a practice background, we do find that services have an impact, both for individuals, for carers and the people that they support, but also at the dyad level. And this is one of the questions we got in advance will pick up on this. And I think it's interesting. We seem quite keen to try and label services as for carers or for the person they support. But actually what we find is that there can be impacts not only on the person who the service is for, but also indirect influences. And that can be for services targeted at individuals. But we also found evidence of what are called dyadic or joint interventions that are designed for the carer and the person they support together, and the impact of that. And then also in the literature, this dyadic approach is recognised as important and valuable by care providers and practitioners. As well as these formal sources of support, we also found various evidence related to informal support beyond the dyad. So far I've been talking about caring as if it exists just with two people. And quite often in situations we can identify someone who's the main or the primary carer, but that isn't always the case. And even if we can identify a primary carer, that carer isn't working alone. There's a whole network of family, friends, other relationships around them. And the evidence we found is that this can be vitally important as supplementary sources of practical assistance. Importantly, we found that these different sources don't seem to substitute, but they complement each other. And in particular, there was one study by Hill, which looked at this in more detail, and found the way in which older couples think around these sources of support as supporting not just them as individuals, but also together as they're trying to navigate through managing care demands and fulfilling caring responsibilities, and also keeping engaged in everyday life and the social activities that they wish to engage in. So that's a very quick overview of the findings from the literature review. I'm going to move now into the interim findings from qualitative interviews with social care professionals. This analysis is based on 12 interviews completed so far. We're still collecting data. We'll be aiming for a minimum of 20 interviews. We've been interviewing a range of people from carers organisations, care providers, national organisations and local authorities. So trying to get different professional perspectives on the topic of supporting older carers and thinking not just about individuals, but also supporting dyads. And the key findings that we've found so far is, perhaps unsurprisingly, the relative invisibility of older carers. In speaking with practitioners, it's quite common to hear that older carers 65 and over are the majority of clients at carers centres and hubs. And there's a narrative there around the way in which it's perhaps slightly easier for them to access services if they're not in employment, for example, and the way in which service provision doesn't present barriers in the way in which is often found for working age carers. Interestingly, in a few interviews, it was raised that older carers aren't seen as a priority group. They're almost like a silent majority, a silent group that are there. But within this very broad group of 65 and over, some characteristics were drawn out as subgroups within that with particular needs and who may be of interest in terms of support and provision. I've listed some of these here. So we've got old, 85 and over, male carers, and some of the barriers that have been identified in other research around engaging them. people with their own health needs, and also those caring for someone with dementia. Now, of course, I mentioned earlier this study was designed and started before, or was designed and funded before COVID. But of course, we started the project in the middle of the pandemic. And so it's not surprising to find that COVID has come up as a topic in these interviews. The sorts of things that have been highlighted, and again, unsurprisingly, are around digital inclusion and access. This seems to be have been a key issue as services have moved online, and the question of how do you support people to access those services. And with the people I've interviewed, some quite innovative approaches to providing support, including voluntary schemes where you pair people up, someone who needs help to get online and someone who will help them do that, through to other approaches where some organisations were doing doorstep visits, or meeting through windows, front garden into the living room, and this kind of thing. Just thinking of ways in which you can still support and maintain some kind of engagement with older carers during the pandemic. Again, key trends that have been talked about are things like increased social and emotional well-being needs, and a changing pattern of service use, either as services have had to be temporarily stopped, but particularly thinking around home care and breaks, where carers are perhaps choosing not to engage with those because of anxieties around COVID and the impact of that. And again, a theme that has come up a few times is an anticipation of a surge in demand post-COVID, and trying to think through how that could be met in some of the challenges. Other trends that have been identified are an increase in risk of carer breakdown or relationship breakdown because of the impact of the lockdowns in England, and also very interestingly around end-of-life planning and bereavement. So there's, I think this has been there around before, but the impression from the interviews is that there's suddenly a greater awareness around carers' needs and supporting their needs, giving end-of-life care in the home. And an interesting shift is carers' organisations beginning to expand support to bereaved carers, which in some places was a gap before, and now is a type of service that's being developed and offered. So other findings, particularly around the benefits and challenges and barriers of this dyadic lens, the evidence that we've collected so far is that generally there's a consensus that this lens is seen as beneficial for a variety of reasons. So understanding the linked nature of needs and outcomes, and it aligns with the Care Act whole family approach. Also thinking about building trust and relationships. So thinking about carer support workers or people working with carers, showing this understanding of the broader context can be really helpful in their practice. Again, there was a lot of talk around viewing everyone on an equal footing, increasing awareness of the carer's needs, so helping in that way. And also from a slightly different lens, thinking in terms of management and strategy, it gives a more accurate view of the effectiveness of services and may then help with the designing and planning of service provision. But a whole variety also of challenges and barriers, and there was quite a lot of anxiety around the potential of losing sight of individual needs, particularly for carers. It feels like there could potentially be a subsuming of the carer's needs to the care recipient, who may become the primary focus. There's also, again, from an organisational level, an anxiety. If an organisation's mission is to support, for example, carers, then by having this dyadic view, might it cause mission drift for them? And that's, I think, an important and very valid question. But then there were practical issues raised as well around data protection and confidentiality, also around the skill needed by staff in navigating the complexity that often exists if you're looking from a dyadic perspective. And also thinking in terms of systems, funding is quite often targeted in a way that doesn't allow or encourage this wider view. There was talk about funding streams that are quite narrow in their focus, short-term interventions with a very narrow target on carers or the people they support. And so that can then drive this individual focus and move away from having this dyadic lens. But even those services commissioned for both individuals, there were some questions around some of the pressures that are in the system. Okay, thank you. And so just to draw together, so having presented the literature review findings and preliminary findings from professional interviews, the next step is to continue and to complete these interviews over the coming weeks and months, speaking with a minimum of 20 people. And we are, in the last few weeks, we've started and will be continuing with interviews with both carers and care recipients. These interviews will be interviewing individually, but we'll be combining the data that we collect so that we're able to look at individual quality of life and dyadic quality of life in our analysis. And the focus of these interviews, we're using ASCOT tools, Adult Social Care Outcome Toolkit tools, which are designed to look at the ways in which community-based support improve quality of life as a way of gaining insights into both the individual and dyadic mechanisms by which community-based services improve quality of life and support carers and the people that they support. So, and I hope I've kept to time, but I think that's the end of the presentation. Thank you.
Thank you. Thanks, Stacey. Some really fascinating findings there at the preliminary stage. So we're going to pause for 5 minutes just to take a couple of questions and comments about Stacey and Wenjing's study. So there's some comments in the chat box and a couple of questions. And some people also posted some questions in advance. So Stacey and Wenjing, I don't know if you have a preference about particular questions you want to speak to.
I'm happy to take the first one. There's a comment from Gillian Powell. During lockdown, did anyone mention a loss of service support? So in the interviews completed, we were talking to professionals from their perspective, but that was something that came up. If you define loss as a kind of change in services and the way that they're provided. And it was acknowledged that some types of support couldn't continue to be delivered for various reasons. There was a lot of effort to adapt services and to deliver them in a different way using online or other creative approaches. But in effect, there was a loss of support for some individuals, combined with individuals then making a decision and choosing not to engage with services because of the risks involved, particularly in home care, because of the anxiety about people coming into the home. Don't know if Wenjing wants to pick any of these questions and add some thoughts.
I might start with the second question from James Townsend about the question is, would be really interested to know whether you've observed any thematic differences between older carers who are currently accessing support and those who are not accessing support. And James suggests that assuming the majority of older carers fall into the latter, which means they are not accessing support. So in our literature review, it's found quite common that the majority of interventions or the community-based services to carers or care recipients, they are targeted to individual rather than the DYADS. And very commonly, the studies highlight that even though some services are targeted on one member in the caregiving dyad, either it's the carer or the people who's cared for, the impact on their quality of life or their well-being is quite often become on both of the people. So it's becoming relational lens is being very strong. In that case, although some older carers, they are not accessing support, but for example, if the people they cared for are having support, daycare center support or other services, their quality of life are still impacted on it. We also were concerned about the assessment of carers' needs in our latest study, but so far, some study, I think this will be relevant to another question from Jessica about hidden carers or how to identify carers. So especially among older carer groups, many people don't identify themselves as carers or they don't go for the carer assessment. So in that case, there are majority of carers who are not accessing support because of the eligibility or the availability of the services. Yeah, I'm not sure whether Stacey would like to add on to those two questions.
No, thank you, Wenjing. I thought that was very comprehensive, and I hope it's okay if we still have a minute or two, Paul.
Yeah, go for it.
Thank you. Just to pick up, there's another comment here from Ellen Nielsen, which I think is very interesting, around the inclusion criteria for the scoping review, and I may pass to Wenjing for the details. But the question asks around, or raises the question of whether perhaps the whole concept of care and caregiving could be abandoned in spousal relationships, and the way in which publications could be missed out because of a focus on caregiving rather than on these existing relationships. So I think that's a really interesting question, and it's quite common, particularly older carers who are caring for a spouse or a partner. They don't necessarily see the relationship in that way. They see their partner, their loved one, and that what they're doing is a natural extension of that relationship. And this is something that comes up again and again in the literature and also in practice. So I think thank you for raising that and a very important point. I don't know, Wenjing, if you want to say anything in terms of the technical aspects around the identification of papers.
So for the inclusion criteria, we mainly focus on older carers, and the scope was international literature, so we didn't put any restrictions for the countries where the study was conducted. And the key part for them to fit into the scope is related to the dyadic subjective quality of life or well-being of carers and care recipients. In our practice, actually, especially for the later stage, if any, because included studies are very limited if they are only exclusively on older carers. So we open up the inclusion criteria a little bit to involve those papers who talk about carers in different age groups, including older carers. So if they discuss older carers in the wider scope, there are comparison or there are in general discussions, we include those as long as they focus on the dyadic or relational scope.
Thank you both. And I thought there was a really interesting question there from Jessica, which might feed into your interviews with carers when you come to that, about that turning point of recognizing of when you recognize yourself as a carer or see yourself in that particular role. Great. Okay, look, some really interesting questions and comments coming through, and it's great to see so many people here today who represent carers support organisations. So I can see some comments in there about the good work that's been happening in building relationships with local palliative care services and GP practices, for example. So please keep those comments coming and questions coming. So we're going to move to the second presentation with Aggie, Bezzina and myself. And I'm going to start that presentation. So I'm just going to share my screen again. Okay, so the second presentation that we want to focus on today is to present some findings from this rapid study conducted last year on online advice to carers. And this was an updated review of information and advice that's available for carers on local authority websites in England. So this was a 4-month study. It was a rapid study because we wanted to capture the information provision happening during the lockdowns in 2020. We had to move very quickly, and we were grateful for the quick support and funding from the NIHR School for Social Care Research in helping us to do this. On the team with myself was Professor Liz Lloyd, Dr. Agnes Bezzina, and Dr. Becky Ali, and we're all part of the School for Policy Studies at the University of Bristol. So Aggie and I are going to talk you through the study and our findings today, and Liz Lloyd is also with us on the call. So just in terms of policy context, we know that the provision of information and advice is a requirement for local authorities under the Care Act, and it's been a recommendation and a provision within carer strategies and policy for some time. So the 2008 strategy, Carers at the Heart of 21st Century Families and Communities, talked about the importance of a commitment to information and advice to carers, providing every carer with the opportunity to access comprehensive information when they need to, and making sure that that's accessible for all and different groups of carers. So we've seen this consolidated and cemented in the 2014 Care Act, where local authorities are required to provide this in relation to what care and support carers can access locally in their area. So in this study, we were interested in what was happening in terms of information and advice for carers during the midst of lockdowns and the impact of COVID-19. So as already acknowledged in Stacey's presentation, COVID-19 pandemic and the resultant lockdowns has placed unprecedented demands and challenges on carers and carers organisations as well. So early in the pandemic, Carers UK conducted a study of over 5,000 carers. Their report shows that 70% of their respondents said they were providing on average an extra 10 hours a week of care during that first lockdown. And unsurprisingly, increased reports of anxieties over burnout, as well as concerns about the health of the person that carers were supporting. So it's within this context that we developed this study where we want to look at website information provided by local authorities. And this project picks up on issues that were emerging from a previous study which looked at information and advice on local authority websites that was led by Liz Lloyd in 2016 to 17, and it was also in collaboration with a similar study conducted by LSC and King's College London. So original reviews are related to information that was provided as a requirement of the Care Act, looking at how local authorities use their websites to share info and provide local advice and support to carers in their area. And of course, the Coronavirus Act 2020 presented an opportunity to revisit those websites, to revisit local authority websites in England and to see what changes have been made in terms of information provision for carers online. So our aims in this short study were to identify how local authorities are using their websites to inform and advise unpaid family carers about what support and services are available to them locally, and to get an understanding about how support and services for carers have been affected by the COVID-19 pandemic. I've already recognised that this study was funded by the School for Social Care Research, and just to add the disclaimer that the findings we're presenting today represent the views of the team and not the funder or the Department of Health and Social Care. So how did we do this? Well, as a team, we developed a data capture form to be able to gather data, relevant information, by looking at the 150 local authority websites. So we were specifically looking at web pages where there was information targeted at carers, and we were interested in what support was available for unpaid carers. And this included support that was offered from third sector organisations, so carer support organisations. And sometimes those carer support organisations were contracted by the local authority to provide key services as part of meeting requirements under the Care Act, or they were signposted, so where they were named as available services in the local area for carers to visit their website and find relevant services happening for them. We want to look at how relevant the information was in terms of how it was conveyed, so in terms of the presentation, how clear the information was it up to date, was it user-friendly in terms of the language used, making sure that the links were easy to use and they took people to the right places, to the right organisations' web pages. We want to get a deeper understanding about how support for carers was affected by COVID-19, as much as we could gauge this through the information available on our local authority websites, and what strategies local authorities and their agents, so agents being carers organisations and other third sector organisations that were contracted to provide services with and behalf of the local authority, how they were using their websites to maintain, adapt and enhance support for carers during this particularly challenging time. And as we looked through every website, as we were gathering data that met the various dimensions in our form, we want to pay particular attention to whether there was information about safeguarding, thinking in particular about the context of domestic violence and the increasing numbers of reports we were hearing about domestic violence during lockdowns, where there is specific information about deprivation of liberty safeguards, about health checks, testing and tracing, hospital discharge, because we know that this was such a huge and prominent issue, particularly early on in the first lockdown, and care homes. And again, because we know that COVID-19 and the various measures in place had such a huge impact on people residing in care homes. So I'm now going to hand over to my colleague Aggie to talk through what we found after we'd gathered all this information. We looked across the 150 websites and we pulled together what we'd found.
Thank you, Paul. So just as a real initial snapshot before going into some more detail, the picture of support that we found is one which is highly complex and fragmented, and with it is clear that there are very huge variations which remain, which is in a way similar, if not even more so than the 2016 study, which looked at websites. So as Paul said, we looked at 150 websites. You have more than half of the local authorities contracting all of their services, including some or all of their assessments, to third sector organizations. You have the reality of some third sector organizations working across local authority boundaries, providing different services or being contracted for different services by different local authorities, but having the same website. And therefore, it becomes slightly complex for a person who's seeking support, depending on which local authority they fall under. You have also other local authorities directing carers to third sector organizations in a neighborhood local authority, for example. You have others who only provide a list of organizations for carers to contact with some of these organizations, so kind of a directory of organizations, which in and of itself is useful, but when it is the only thing provided, and when some of the organizations have names like Angel Trust, and where it is very difficult to know exactly what it is that is provided, it could be difficult for a carer to go through each and every one of these to identify what it is that they actually could get support from. You also have, we also encountered a few local authorities who, on the basis of what there was on the website, do not appear to have any services at all for carers. And also there is a reality of around 10% of local authorities where there appears to be strong partnerships with the local NHS, clinical commissioning groups, or hospital trusts. So as we can see, a hugely varied picture geographically, and also a hugely fragmented picture. Could I have the next slide, Paul? So going into a bit more specifically what we have seen as the main impact of COVID on existing support for carers. So interestingly, around 4 out of 5 local authority websites were updated with services to reflect changes that have happened because of COVID. So what were the most common changes that we have seen? And this is actually, I've listed them in accordance of frequency that we have seen them happening. So there is the obvious one, which is the switch from face-to-face to online and telephone services. So a lot of people have been directed to the fact that the service hasn't stopped. It is just being provided in a different manner, online or through telephone. We've seen the physical closure of carer centres. So with a lot of the support being provided, such as peer support, training groups, moving to online. We've seen also reference to the physical closure of day centres, which as such, although the day centres are not for the care, very often are not for the carer as such, although sometimes it also is for older carers, will have a direct impact on the caring responsibilities of carers. So, and in such cases, what we recognized also was that it was not always clear whether the day centres are closed for new service users or also for present service users, and also the timing of how long they were closed for, whether they've opened again or not, then after the first lockdown passed, was also quite unclear in some situations. Also recognizing the fact that it was such a changing scenario that it did not only require a website to be updated for COVID, but also to be constantly updated as to what is happening kind of almost day to day. Something else is the emphasis on the importance of the emergency card. I think this emphasis was potentially already there before, the importance, but I think it became much more pertinent within the COVID context. So a number of local authorities utilized the COVID context to say, this is really the time where you require, where it would be really necessary for you to have the emergency card. Could I have the next slide, Paul? So with regard to information on COVID-related support, so specific information we have seen in relation to COVID and how carers can be supported. And again, according to frequency of how often we've seen something being mentioned, there's general advice on shielding and infection control, which we have seen feature very, very highly. Signposting to community hubs, to helplines for the practical access. For example, I mean, if you are shielding, you then need someone to be doing your food shopping, picking up prescriptions. So signposting to hubs, most of which have been created because of the COVID reality. We've seen also quite a bit of advice on mental health support, particularly in relation to isolation and loneliness, and also in relation to money problems. So we've seen some advice on financial support, and as the project went along, so we were collecting data from sort of August till December of last year. We saw much more reference to warnings on scams. So as time went by, it is evident that the scams increased and therefore the warnings increased as well. And on web pages for carers, specific web pages for carers, the majority of local authorities provided links to the government guidance, so the gov.uk guidance, and also the Carers UK coronavirus guidance. Could I have the next slide? Thank you. So what adaptations, innovations did we see? And again, we're giving some examples in order of frequency. So firstly, a high increase in one-to-one phone counselling and proactive well-being calls, which are, where actually there is not the waiting to see whether the carer actually needs it, but proactively reaching out to the carer. The use of newsletters and social media increased significantly to pass on information and to reach out and to provide that sort of support. We saw an increase in online courses, so courses such as caring during COVID, and also, interestingly, developing IT skills, where IT skills have became almost like the main point of so significant for carers during during the crisis of COVID. We saw also an increase in online activities, so things such as baking and gardening tours, etc. Some other examples that, just to mention a few others, increase in access to, for example, assistive technology, increase in bereavement support, interestingly, obviously, because of the COVID context, there have been more deaths and more carers left bereaved. Extensions of videos and DVD libraries. Again, very, very interesting innovation, laptop and iPad loans for carers who may not have had the access to that sort of technology before. We've also seen extended outdoor meetings, and in a couple of cases, again, very interestingly, the offer of a COVID-19 bespoke carers assessment. So something that recognizes that during this reality, your needs, your support needs are going to differ, and you are going to need something specific. Could I have the next slide, Paul? Thank you. So what did we learn? So through the slide, what in a way we wanted to communicate is what the minimal support looks like and what the better support looked like from our left, from our eyes, from the lens of the people who are going through these websites. So you had examples of websites offering very minimal support, which only emphasize, for example, carers' responsibilities for shielding, advising carers to go elsewhere for support, providing, as I said before, just a list of agencies, just a directory where you can look it up yourself and check which one you may be able to access. That tend to tell carers what has been closed down rather than what has continued to be provided, and which only provide links to Carers UK or the Gov UK guidance. So that is just an example of how some sites had this very kind of minimal information. On to the much better sites where the emphasis is we're here for you. So there's a positive sort of narrative of reach out to us should you need that help. We know you are in a situation which is harder. Reach out to us. We're here for you. So the perception about the anxieties, about where there is more information and links to issues of safeguarding. What if your loved one goes into hospital? Information about care homes. Where there is more information about how the local authorities working in partnership with third sector organizations. So what is offered by the local authority, what is contracted out, and there is clarity, simple clarity. You have those sites which are health aware, so links to GP health checks, encouraging carers to actively get health checks, and also mental health aware. So encouraging carers to recognize that within the situation, they may need additional mental health support through, for example, with the provision of counseling. And also those sites which have a very simple way of pointing carers to that general practical support, you know, food deliveries, medication prescription, collection, and also to the reality of scans. Next slide, Paul. So with regard to third sector organization websites, which we were obviously also sifting through and looking at, the majority were informative, active, proactive, sociable, and welcoming, which was so encouraging to see. So informative, as in, you know, using different media, trying to be really creative in ways of reaching out to carers, offering courses, offering groups, extending video libraries, you know, being really open about the telephone advice, and we're here for you, we're just a phone call away. Active, a huge amount of yoga, we noticed, mindfulness, meditation and other kind of self-help provision. Proactive in not only waiting for the carers to actually reach out to them, but also contacting carers themselves who are known to them and who they would be aware of would be under pressure, and proactively reaching out to them, lending laptops, lending iPads, you know, to make it more possible for them to keep in touch. Sociable, there's the kind of the use of social media has been used significantly during this time, and also welcoming to new carers. I guess the one thing that perhaps we noted with regards to this is that a positive thing very often about third sector organization websites is that there's a certain togetherness and chumminess which is created, which we just wanted kind of to communicate a word of caution that may actually act as a deterrent to a carer who does not feel that they fit the dominant culture of the group, and therefore may feel almost like I will not belong within this context. Next slide, which I think is the last one exactly. So just to conclude, we believe that COVID-19 shone a spotlight on the weaknesses in support for carers. So again, going back to what we said at the beginning, how the outsourcing of support has led to fragmentation and complexity, and how the inequalities in support, you know, the postcode lottery basically still exists significantly. Recommendation that local authorities could use websites more effectively to show they have close working relationships with third sector organizations, and also how and who's doing what, and with more clarity, and also that they have an active interest in the well-being of carers. So those were some of the very good websites we've seen where there is an obvious interest in the well-being of the carer. And finally, that local authorities and third sector organizations could improve websites by ensuring that links are in working order. Again, for someone who may be using these for the first time, it can be quite difficult, and therefore, if at least links are in working order, that makes it an easier process. Test driving them for usefulness, also through perhaps test driving them with actual carers to see how easily they find them, to navigate through them. And finally, ensuring that information is consistent, coherent, and up to date. Thank you. That's it from me. I realize I went slightly over. Sorry, Paul.
It's okay. Thanks, Aggie. And I should have added when I was talking through our aims for the study. So we did this data collection between September and November 2020. So after the first lockdown, but before the Christmas and winter lockdown. So of course, what we've spoken about today does just represent that time period and may have quite changed dramatically going into that Christmas and winter lockdown. Okay, so lots of comments and questions. Great to see. Yes, we will share the presentations after the event, and we'll send around a link to the recording. I'm just looking through the questions about the presentation we've just given. Aggie and Liz as well, are there particular questions or comments that either of you want to tackle?
I'm just going to quickly skim through them.
Yeah.
I don't know whether Liz has seen anything that she wants to start off with.
I could talk about the relationships with the CCGs and NHS and the voluntary sector. One of the things that we identified as we were going along was how websites changed as we were going. That was another complication, really, that it felt like we were on shifting sands all the time. So that's why in the report, I put that around 10% of local authorities had good working relations. But bear in mind that what we're talking about is what we saw on the websites, not what actually exists on the ground. So it could be that a local area have very good partnerships going, but the local authority website didn't really show that. So that's a kind of an important rider. And I've noticed that a couple of people have said, were we one of them? Or, you know, so I don't think we could find out what was going on with your local area, but you know, you'd have to, if you want to email, I'd be happy to have a look. I just don't want 150 people asking me the same question, really. It was, yeah, it was the strong links made a difference often in terms of the kinds of quality of information that was there as well, because it kind of felt like there were more heads involved in presenting the information, so it was a better quality. And the other thing about the Coronavirus Act is that that was something that was really notably changing, because sometimes people invoked the I can't remember the name of the procedure that local authorities went through now. The easements, that was it, wasn't it? Easements, and then they withdrew from them, or you know, so that was one of the examples of things that were shifting very rapidly during the course of the pandemic. But the last point I would want to make is that in terms of what Stacey and Wenjing were talking about earlier on, those links with health seems to me, when it comes to, especially when it comes to older carers, but not only older carers, that's where a lot of the stuff about hidden carers really comes in. You know, it seems to me that it's health staff that see people and need to have a kind of a health lens to look at the situation. You know, and also I just think we need to relax a little bit about the sort of, first we must determine whether you are a carer. You know, it's like, it's what people are doing, not what they call themselves or what somebody else might call them. It's what they're actually doing that really matters. That's really my response to some of those questions. Sorry.
Well, thanks, Liz. I noticed Jessica's got their hand up. Jessica, would you like to switch your mic on and
yeah, thank you. It was just in response to Liz, and I'm also thinking for you, like, you don't want, you know, 100 people emailing you saying, were we one of the good ones? Are you able to share which websites they were so that we could all then learn from that and we would be able to then see whether we were or not? Or is it confidential?
It's not confidential because this is all publicly available information. They're public websites. So we could point you in the direction of some of the ones that we found to be good. Certainly, it wouldn't be an exhaustive list though, because this was a very rapid project and we wanted to get the results out quickly. So after we'd done, I don't know, somewhere short of 100 websites, we'd established categories for analysis, and we were doing this as we went along. We had to work really fast, so it's possible that there would be some in the latter stages where we answered the questions on our analysis sheet, which didn't give us as full a picture as we'd done for the first 50. We had pages and pages, and it was clear that we just simply, it was going to take us months, well, it's going to take us a year to get through all of them at the rate we were going, so we had to speed up. So what I can give you is some examples of good ones.
Yeah, that would be so helpful, thank you.
We'll put our emails in the chat box, and as Stacey and Wenjing, you might like to do the same as well in relation to your study. Okay, so feel free to, if there are questions also for the first presentation as well that people wanted to go back to, feel free to either put your hand up using the reactions button at the bottom, or put your name or questions in the chat box.
There's a question about what proportion of websites were static, acting like a notice board, versus interactive, where you can actually access support via them. I don't know, Liz, whether you'd be in agreement that the majority were interactive, where you can access support via them. However, the extent to how easy or not that was would have varied drastically between one local authority and another. Yeah. I mean, I'll never forget one particular local authority where you have access support here as a box, but every time I tried to go on that box, the box shifted. It's all, which for me was really frustrating, but for someone who perhaps the fine motor skills are becoming a bit more difficult or whatever, have been even more difficult. So I think the ease of access is what was different. I don't know what you thought, Liz.
No, I agree. I think ease of access, but also how complicated it looks. And if you're interested and somebody says, how do I, there might be a thing on the website that says, how do I obtain support? And then the first question is, first we must determine if you are a carer. It looks like you're going to be assessed for what you do, how well you do it. It looks kind of, I think it's a real turn off, actually. It looks like, do you qualify for support from us? Whereas actually the 2014 Care Act was meant to open it out so that people would get some help. And if the local authority said, you're going to have to go there for your help, and you don't qualify for our help, that should come after an assessment, not before. So I felt that some of them were massive hurdles put up in people's way. So there was that as well. But I think you're right, the majority were the question, how do I get support? And you might get an easy link, or you might be sent around the houses, or you might be directed to, as you said before, a list of local voluntary organisations, or the worst of all was go to the next borough. Yeah, so there were a few of those as well, only a few.
Thanks, Liz. Angela, I notice you've had your hand up. Did you want to unmute?
So I find it quite interesting. I'm a chief officer for a voluntary sector, and we carry out statutory assessments and holistic support for carers. I find it really interesting, the results you've got, but I also think perhaps it doesn't reflect a true picture of what's been happening on the ground, because the ground is where it matters. So we hit the pandemic like everybody else, and very quickly a lot of services either had to decide to furlough or evolve from it, take into account that not everybody's IT skills were brilliant. So we quickly upscaled our IT skills, bought a lot of equipment, and remember, it's all got to be funded. And then we also had to upskill the people we support. We then actually opened from July and have remained open, working with public health and the NHS to deliver face-to-face. And we have been acknowledged for the IT projects we've done. But as regards to our website, we're completely redeveloping ours. And this is where especially in the voluntary sector, we were reliant on funding. A lot of our funding streams were cut. So to redesign a fully interactive website, you're looking at £5,000 plus. Take into account we'd already spent 20,000 uplifting the centre to make it as COVID safe as possible. I think maybe the expectations have been a little bit unrealistic from some professions and some of the research that's indicating this. So when our website goes live, it will be fully interactive in about a dozen different languages. It will be suitable for people that are hearing impaired, visually impaired, that are living with any learning disability, but all that takes time in the middle of a pandemic. But you are absolutely right, and it's one thing, I'm actually a parent carer, and it is those assumptions that are made and that question, well, do you meet the criteria? I quite agree with that, Elizabeth. It's a very valid point that actually initially people want to talk to somebody about their role they're doing, and then you establish what is the extent of that caring role rather than putting up the barriers first. Now, we are commissioned by our local authority, so we have the luxury, we have a triage team. So any incoming calls come directly to them and they talk about it. But for me personally, the first time you often become a carer is when somebody's in hospital. That's your first, and people make the assumption. So for us, it was, you were fairly well educated, you didn't have any financial issues, you weren't known to social services, so therefore you didn't get any support. But actually for me, is the biggest impact on carers is emotional well-being. So you might manage the shopping, the personal care, you know, and various other things, hospital appointments, but actually supporting a child and adult with long-term conditions or substance misuse emotionally is draining. And that's where most of our carers are having a huge impact. And I think that's what we need to get better. And it does bear from some of the presentations about how we interact, that hidden care as well. Some carers actually don't recognise themselves, but actually they might not want to be recognised. They're quite okay. And we've got a bee in our bonnet at this moment of time about hidden carers. And I think we're going at it the wrong way. I think it's opening that conversation on a soft level about understanding people, rather than, as you say, we've got a Care Act and everybody fires those questions, don't they? Are you a carer? Do you do this? What do you do? What do you do that? Well, if you're in a caring role, often you're overwhelmed anyway. And then people are firing all these fairly targeted questions. And for us as an organisation, I think it's working in partnership, but being softer around that approach, but also realistic expectations from the people we work with. Because I think as a voluntary sector, we've been one of the least recognised and unpaid carers throughout this pandemic. And I think that's really sad. And we haven't been able to gain any support from government funding because of how we're set up as well. So I think it's all around that. So we are getting better around websites. It was difficult to juggle everything, but it is that softer approach. Sorry, I can get on my soapbox because I'm on both sides, because I'm a parent carer and I have this role, and you can see all the dynamics. For me, collaboration is key in sharing good practice.
Thank you, Angela. And I wonder, Paul, can I just jump in?
Yeah, go for it, Stacey.
Thank you. And thank you very much for that contribution. And also, I'd like to pick up on some of the points made, but also link back to Liz and some of the comments that were made earlier around hidden carers and also identifying carers. So with the particular project, the DYADS project, this isn't something we're specifically looking at, but it does relate to a project that I did a couple of years ago. Particularly looking at the question of how do we identify carers and asking a question of how that could happen through GP practices. And it was an interesting piece of work. We chose GP practices as most people in contact with GPs, but we did eventually broaden out and look a little bit at pharmacies and other community services. And it's interesting that a lot of what's being said here around people not wishing to identify or not identifying as a carer, and how you frame the questions in a way that's gentle and soft and doesn't require someone to tick a box that might provoke anxiety, is vitally important. In that work, we identified some GPs who are already doing this and have various processes in place, but it's quite patchy. And there does seem to be anxiety among GPs around identifying carers and then not necessarily having any support to offer them, or not having the confidence of knowing where to signpost them onto. So I think Angela talked about partnership working. It's something that's come up again and again. I think that's really vital. And sadly, that project finished and we didn't get the follow-up funding. But from my own part, Kent's recently opened a medical school, and the hope is in future years to have some teaching which will be able to integrate some of the research knowledge that we've gathered to try and raise the profile of carers among trainee medics, and hopefully that will in future years begin to address some of these questions around confidence and knowledge and awareness.
Thanks, Stacey. Liz, did you want to respond to any of the
oh, well, I mean, I agree that Angela raised, yeah, she raised some really, really important points. And Angela, I absolutely don't think that the voluntary sector has any reason to feel at all under attack from the report that we wrote. I noticed that somebody else has you know, asked the question, how many carers actually look at local authority websites? And well, I think we're in a really difficult position here, because local authorities are meant to be communicating with local carers, and that's what they should be doing, which might mean that they say, go to your local voluntary agency for carers. Yeah, that's not a problem, as long as the link works and they can say what the local voluntary sector does. It doesn't really, having a website doesn't mean you've got to be doing all the work and doing all the communication, but it's quite likely to be somebody's first port of call, particularly if they're caring for somebody who's known to the local social services. So, so you know, you can't expect local authorities, you can't expect the voluntary sector to soak up all of the responsibilities of the local authority, because, as you've said, Angela, you don't have the resources to do that. You know, the money just isn't there for the local voluntary sector. So that, you know, we're in a bad position here, which is why it's so patchy, I think, why some local authorities maybe building on something they had before, or because they've got more resources, or because there is a local carers champion, or for whatever reason, there are some local authorities that have done a better job. And I'll give you one example of that, which is that most of the local authorities we looked at didn't mention anything at all about the possibility of abuse in relationships where care is involved. And that struck us as being quite a gap, because there was lots of information last year about the increased amount of domestic violence because of COVID. And you would have thought that, you know, something could have been flagged up there. And there was, I hesitate to say, I think it was Southampton, but anyway, there was one local authority that said something along the lines of, you know, we realise that you're likely to be under a lot of pressure. If you feel that you want to talk to somebody about this, phone this number. You know, so, and that's such a, you know, I think that's such an important message, really, because it shows that somebody's recognised that you're under pressure, and they're reaching out and saying, you know, it's okay to be feeling like that, and call this number for some support. You know, that was just one example of how some local authorities had their finger on the pulse, whereas others didn't. Sorry, went on my own soapbox there.
Got lots of important soapboxes today, which is good. That's what we're here for. Okay, look, thank you. There's lots of really interesting comments, and I can see people are also sharing some of the personal challenges that they've encountered in their role as a carer, and the important support they provide to people close to them. So what I might do is I'll ask each presenter just to pop their email address in the chat box, if that's okay, just so people have a chance to make a note of those before we finish for today. Thank you, Wenjing. So you've got the contact details for Stacey and Wenjing, the DYADS study at Kent University, and then Aggie's email address. And if you contact any of us at Bristol, we're able to pass that on to the relevant team member. I just wanted to ask if there were any other final questions or comments in relation to the first presentation. Just to open that up one final time. Great. Well, hopefully people will feel encouraged to contact us directly, contact the relevant researchers directly. We're always happy to talk through our work. And there was one, I will mention, there was a question about how we're going to disseminate it to local authorities. And we've been thinking about that ourselves, because it's important that we make sure these messages get to the right audience. And we've presented this work at a previous seminar for the School for Social Care Research, and and Liz, you have to remind me here, we've either been in contact with DYADS, which is Association of Directors for Social Services, or we're in the process of contacting the Directors of Social Services, so that association. In the process, yeah. But we think that's possibly one of the key ways to make sure we get this information out there. And we've included a link to the SSCR website with the full report. Okay, look, very big thank you to everybody for your time, for your contribution. It's great to see so many people clearly passionate and invested in this topic. And it's clear that we're all on the same page in terms of wanting to enhance support and information provision for carers more broadly. Our thanks again to the funder, NIHR School for Social Care Research, for funding both these projects. And nothing left to do except to wish everybody a very good rest of the day. And we'll be in touch soon with the presentations and a link to the recording of the seminar. Thanks for your time today.